Hello and welcome to Module 3 of the LMET course. Today we are going to be talking about symptom management at the end of life, as well as symptom management throughout palliative and hospice care. I want to really focus on symptoms associated with nearing end of life, and describe how we can prevent or diminish symptoms as patients approach the end of life. Referring back to the NCP guidelines, we're going to talk about domains 2, 3, and 4, which are all about the physical, psychological, and social aspects of care. So as we talk about each of these, we're going to talk about relieving suffering and improving quality of life. As we talk about symptom management, it's important that the nurse is really able to assess and evaluate symptoms. This is an essential part in caring for patients on hospice, palliative, and during end-of-life care. It's an ongoing process that evolves as the illness progresses. Managing symptoms requires a very cohesive interdisciplinary teamwork in order to ensure the optimal care is delivered. So that means close collaboration between nurses, physicians, and other members of the healthcare team. Reimbursement issues and financial concerns are often some very major barriers that patients have to overcome. It's incredibly frustrating as a nurse when you're trying so hard to get the patient the care that they need, the medications they need, the symptom relief that they need, and they can't access it because they can't afford it and there's not reimbursement. So barriers, things that really need to improve, ways that if you choose to go into policy or other types of leadership roles as a nurse, reimbursement concerns are huge. So it's really important that we fight for insurance companies to cover these types of charges. And of course, as with pain management and a lot of end-of-life care, more research is needed. But ultimately, the overall goal of that symptoms management is going to improve physical well-being and functionality, as well as improving quality of life. Suffering, whether it is physical, psychological, social, spiritual, it all affects quality of life in every dimension of life. So symptoms create suffering and distress. This can be psychosocial, this can be physical, spiritual, existential. Really what we're trying to do here is decrease the suffering associated with those symptoms. So some things that patients are going to experience are things depression, nausea, worry. They're going to have decreased functionality, decreased mobility. And so as we go through and assess and identify what it is the symptoms are causing suffering, we can address them. And as far as ethics are concerned, there's really an emphasis on the beneficence and non-maleficence. So doing good and preventing harm. Symptom management, we're going to talk about the older adult here throughout this course. This is applicable to pediatric, perinatal, juvenile, young adult, but really we're focusing on the older adult. And this is a really complex population because they tend to have multiple comorbidities, which really increase the number of symptoms experienced throughout the illness trajectory. While cancer is one of the first things we think about with the terminal diagnosis, the majority of hospice diagnoses are not cancer related. And so even though they're not cancer, they are related with a very heavy symptom burden. So things like CHF, COPD, dementia, these all are heavy with symptoms both for the patient as well as for the caregiver. It's also very complex caring for this population because really there's more going on than just the comorbidities. There's also the social aspect of life. So the patients may have lost a partner or a spouse. They may not have children living close. They may not be able to drive. Their living friends and family may be too ill to take care of them. Remember, the caregiver is often more sick than the patient is. And there may be a history of abuse, of neglect, and social isolation is a really big thing that exacerbates the suffering that symptoms cause. As we discuss symptoms, we're going to group them together in systems. So we've got respiratory, GI, psychological, and then generic symptoms. And we'll talk about each of these in turn with their own video.